Hi everyone, welcome back to the Hair Loss Show. Russell, good to see you again.
Thank you, Vikram. Hi everyone.
It's been a while since we've done some filming, so that's really good.
We've been overseas. We've been to conference. Our brain is exploding with new ideas and information.
That's right. I know it's been really good. So I think one of the things, having been to, we recently were in Denver at the World Congress and being able to collate and share ideas with everyone that was there. I think one of the things, the topic certainly to talk about, and something that the public will be interested in, is just the general concept of, okay, well, can we cure hair loss? I mean, people come and see us and then they talk about, okay, what do I need to do to stop the progression of hair loss, to stabilize things. The follow-up question inevitably is, well, how long do I need to be on this? Because most people at some level who are not on chronic medications, but certainly the population that we see don't have chronic conditions, and so not taking long-term medication. So their experience with medication is generally a course of antibiotics that will be 5-7 days, and they finish that, and then that's
Correct.
it. This is somewhat different. I mean, we're not dealing with a pathological condition. Right? There's, most of the time,
Usually,
yes, when we're dealing with hair loss that people are experiencing, it's not pathology, it's a natural condition. But again, the question is, well, how long do they need to be on treatment for?
part of the problem is that if you look at the headlines that come through in newspapers or electronically, they talk about potential cures. Every time there's some new treatment available, the word cure pops up into the headline.
Yeah.
And it's very misleading for the general public, because the reality is there isn't a single hair condition we know about of hair loss that we can cure. We can manage to a certain degree, but we can't cure it. So we get this question a lot. For example, I have patients who've come to me and said, yes, I took the treatment that you said, Dr. Knudsen, and I said, are you still using it? And they said, no. And I said, why not? They said, well, it got better, so I figured I could stop. And that's when I have to try and explain to them that hair loss is like treating diabetes or treating high blood pressure or treating arthritis. That none of these are curable.
Yes.
They're just manageable. These are lifelong conditions. And the thing that really is kind of a little bit depressing, I guess, for people to understand as well, is that there is hair loss conditions that we've talked about, like male pattern loss, female pattern loss, and there are other conditions. But there's also the aging loss. People, are not going to have the hair at 50 they had at 20, and they're not going to have the hair at 70 that they had at 50, for example. And so this is something that they have to understand and factor in, that there's more than one thing at play here.
Yes.
And that what is normal for your age versus what is abnormal for your age. Now, the good news is when we're treating hair loss with stimulants, for example, like minoxidil or laser or microneedling, it works just as well for aging hair loss as it does for anything else.
Yeah.
Because we're really just trying to say to the hair, stay healthier for as long as possible. And that's the word, as long as possible. So it is a bit confronting, particularly because a large part of any of us, the population that comes to us for treatment, are young. They're healthy. They're not used to taking things anyway.
Yes.
And then when you tell them they're on something for life, it's a bit
jarring.
A bit of a jarring. But I really don't describe it like that. They say, how long do I need to treat it? And I said, well, as long as you care.
Yeah.
Right. So the point is, if you tell me that in 10 years' time you wouldn't care, then that's when you stop treating. Right. You only need to treat it while you care. If this is a premature thing for you, in other words, I could deal with this in 10 years' time. I'm just not ready to deal with it now because it makes me look older. It changes my social, presence. Mm-hmm. Then just do it while it bothers you. Yeah, and we are big fans of using as little as possible current medication to get the effect, because we are asking healthy people to take something for a prolonged period of time. Mm. So that's my emphasis on it. No, you don't have to take it forever, but you have to take it for as long as you care.
Yeah, and I think it's important. I mean, you raise a valid point, because one of the questions that I get, which I know you get as well, is, well, I'm a bit hesitant about taking the medication. I understand, it may thicken up, it may stop the progression of the hair loss, and there's a chance that it may thicken up some of the hairs, right, which are all true. But then the consideration is, well, if I to take this medication to achieve that, then I'm committed to taking that, because then if I stop taking the medication, then I lose the gains that I made. That's the common statement that I keep hearing. I'm going to lose the gains that that I've achieved by the medication. Therefore, I'm committed to taking the medication.
Yes, and people say to me, look, I don't want to take it because when you stop it, you get worse again.
Yes.
And I said, but that's the whole point of taking it. And so the other aspect of it that I think is really important for the general public to understand is that if you're using stimulation therapy, which, as I said, is like minoxidil or laser or microneedling, patients will come to me and say, oh, it worked for 12 or 18 months and then it stopped working. That's actually a misinterpretation of what's going on, because for a lot of hair loss conditions, the condition is going to progress over time. But when you're using things like minoxidil or you're using laser or using microneedling, you aren't necessarily stopping it in the tracks, but you might be dramatically slowing it down. So there's just a very slow progression over time rather than a more rapid progression of time. And the proof of the pudding for the patient is in the eating, because when they stop taking the tablets, they deteriorate quickly.
Yes.
They don't deteriorate slowly.
But the key point there is that you will never deteriorate to a worse, to a lesser point than you would have had you not been taking the medication in the first
And
place.
that is the thing that confuses patients too, because they say, I know what I looked like at 35. I went on minoxidil, for example, and I was till I was 40, and then I stopped. And when I stopped, my hair fell out, and I was worse than when I started.
Yeah.
And then I say to them, yes, but that's where you would have been anyway.
Correct.
That's the whole point. It doesn't harm you. It only takes you to where as if you'd never been treated. So it is a bit disconcerting to patients and open to misinterpretation. Yeah. But it doesn't accelerate anything past what nature had intended for you.
Correct. So I think that that highlights the fundamental issue that with the current technology that we have, it will only be effective when you're taking the medication. And the answer is no, you're not forced to take the medication for forever. It is a personal choice, and that's the journey that you are on, and how important keeping your hair is at every stage for you. And that's something that you need to be able to discuss with your physician and be able to navigate that path, and then see what works for you at what phase of your life, and if there are certain things that don't work at different parts, then be able to modify the regime.
Yeah, I think it's important to stay in touch. It's one thing to take it, and then when a patient comes back to me and I haven't seen them for years, and they tell me they stopped a couple of years ago, and I said, well, why? And they said, well, it wasn't working. And I said, well, what do you mean it wasn't working? And they said, well, I wasn't getting better. And I said, yeah, but were you getting worse? And they said, no. And I said, and what happened when you stopped? I got worse. I said, well, it was working.
Yeah.
The first level of success for therapy is to stabilize the loss and maintain what you've got. The second benefit, which is what people assume is always going to be the benefit, is improvement. But as we've talked in other videos, you've got to be early in the phase of hair loss to get significant regrowth. The longer you wait and delay to start treating, the harder it is to regrow the hair.
And I always say to all my patients, I think you say the same as well, which is that, look, take the medication. My hope is that you are stable. If we can demonstrate stability, then that means the medication has worked. Anything over and above that is just a bonus.
Correct.
Like if you go in expecting that, what I found is that if you say, oh, there's a certain percentage thickening, then our patients just hang on to that, and that becomes the expectation. Whereas the expectation should be stability. That's the victory. Anything above and beyond that, that's just
that's a bonus.
That's a bonus. Perfect. Cool.
So I hope that helped explain this to you, that it's good to develop a relationship with a physician over a period of time, because this isn't, as Vikram said, this is not like treating an infection where it's all done and dusted in 2 weeks. This is a problem that is going to continue to exist going forward over time. And you do a lot better if you develop that relationship with the physician and continue to see that physician. And if you're not happy with the results, then maybe that physician is going to modify the treatment program, because some people have more aggressive balding, some people have very mild balding. So we're big fans of customizing treatment to what we see in front of us. So it's really important that you don't give up on the therapy if you don't get what you expect in 6 or 12 months' time, but to work with your physician, who usually will be more than willing to try and assist you to get to your goals.
Yeah, very good point. Well, very good. Well, thank you very much for watching this episode. Hope you found that useful. Please remember to like and subscribe to the channel, and we'll see you again on the next episode.
Thanks, everyone.
See ya.